Welcome to Called to Care, the Harbor-UCLA Medical Center podcast. This episode, we're talking to Harbor-UCLA Medical Center Chief Operating Officer Judith Millsap. I'm your host, John Flynn. Welcome to the podcast. Would you introduce yourself and tell me what you do?
Sure. Hi, I am Judith Millsap. I am the Chief Operating Officer here at Harbor-UCLA Medical Center.
What does a COO do?
Oh, a COO is the person who really supports the teams that do a lot of the work that you don't see on a day-to-day basis. It's the work that keeps the hospital running, from our facilities teams to our environmental safety officers and the teams that support our security in our hospitals. We are the backbone to the operation. I do have some clinical areas as it relates to radiology and our rad techs and the work that happens in the rehab space. But much of the work is really behind the scenes, and it is the space where we really ensure that folks have the appropriate environments, infrastructure, and facilities to be able to effectuate their work.
That's going to be a big job as we roll out new buildings, isn't it?
Oh, I know. It's a big job. It's exciting. But it's interesting to look at the future in that way from a standpoint of the appropriate staffing models and how we can even effectively combine technology into the spaces to ensure that we are able to provide the services, opportunities, and care in a way that helps to not just center patient care, but take us to the next level.
Let's find out a little bit more about you. What were you doing right before you came to Harbor?
Oh my goodness. I came from one of the largest university system in the nation, the California State University system. I worked in the system-wide office and did a lot of work to support the 23 universities across the state of California.
So it sounds like you went from the largest public university, university system in the country, to the second largest healthcare system in the country. So you know something about scale. You know something about getting things done with a lot of people.
With a lot of people. And I would say that the most critical part in leading in these types of spaces is understanding how to be an advocate. It's being able to find the gaps and opportunities and determine how you can actually effectuate change in a way that helps everyone understand their roles, their responsibilities, and the structures of accountabilities that are needed.
Are you thinking about something in particular at Harbor when you talk about that? Are there challenges right now that you're working on?
Oh my goodness, we are in healthcare. and unless you've been living under a rock, you understand the impacts that healthcare has had recently in not just Los Angeles County, but in our nation. And so there's a lot in Harbor and in healthcare in general that when I came into this role, I understood I need to understand how to appropriately advocate. I need to understand what the opportunities were and what the gaps are and how to appropriately analyze and effectuate change in a way that sometimes doesn't feel good, but you understand that it's appropriate for the organization.
I guess it's kind of foolish of me or naive of me to think, oh, well, you're not dealing with a lot of the patient-facing action.
Sure.
And yet everything still ripples to you because you're responsible for everything around it, right?
Sure. Yeah. And I really counter that by saying all of the work that we do, no matter what your role is in a medical facility, is patient-centered. And when we consider our work in that way, then we're being intentional about our strategies and our plan and our actions.
Sounds like a critical value that you need to make sure everybody understands, from the paint shop to my IT brothers and sisters,
right,
to whoever, right?
Yes. Yeah. I've had what I would say the privilege of working in spaces that were not just about the work, but about the people that it really impacts, and being able to have the opportunity to do things that would leave significance beyond my own existence. And I've been intentional about doing that work. I was, really young when I thought maybe I'll work in entertainment, and did some work there, but realized very, very, very quickly that I really wanted to do work that helped people, and have been so privileged to do that in a variety of ways. Certainly at the state university system, where there's a huge opportunity for social mobility for the students that come through the CSU system. But when the opportunity came for me to consider Harbor-UCLA, it was the same thinking that I had, to be able to make an impact and not just come to work every day, but to understand that what my work does significantly impacts the community and the patient population that we serve.
What you're talking about sounds like a value of service that sounds like is very deep inside of you. And yet you started thinking about entertainment. So where did that value of service come from in your past? Where did you get
that's
that?
a great question. I would have to attribute that to my parents, who really centered that thinking and that ethic in terms of working in a way that helps to help others, that works to help others. And we were always doing something in the community. As I was a child and growing up, we were always on the weekends going out to help the homeless or participate in some sort of community organization and giving back in that way. And so it was something that was really instilled in me as a child. My mom was I would say, elementary school teacher and administrator. So she started as a teacher in elementary school, and she was also a resource specialist, and had a focus in the area of students who needed additional support in their educational, academic journey in elementary school. And so she had an amazing heart for helping children to not just survive, but to thrive academically. And I just watched and witnessed her on many occasions as a child, being in the classroom, and the way in which she approached learning and had the one-on-one focus with students to ensure that they had a unique and personalized experience in the classroom. That was really, I think, even subconsciously a part of the way that I even lead. It's interesting to see how some of these dynamics that you don't even realize you're picking up on as a child become a part of who you are as an adult. I would be remiss if I didn't mention my dad. He has had and continues to have such a huge impact on me. And like I mentioned earlier, my parents were really intentional about helping us to understand the importance of caring for others. My dad did so much in supporting the community, both locally and internationally. I saw him do so many things, which, really led me into a lot of the roles that I've had throughout the years. Certainly my first role in a medical space, which was with a global medical organization, or I led the operations there, helping providers, doctors, dentists, and nurses to go out into these global areas where medical opportunities were very scarce, and ensuring that they had the requisite supports that they need, both in terms of resources and agency abroad with local government. Having that as the core of who I am, I completely owe that to my parents, with my mom and my dad.
Where'd you grow up?
Oh, I grew up here in Los Angeles.
Where?
I am an LA native. And it's so interesting. I have family that lives, near here to Harbor, and have, in my entire life. So from Inglewood to Torrance to Los Angeles, proper West LA. I've lived in all of these areas, and so I am a Los Angelino. I've had the opportunity to travel all over the world, but I will always live in Los Angeles. There's no place like Southern California. The experience, the diversity of people, thoughts, ideas, food, It's a wonderful place to live in, and you really can't ask for better weather, really.
So I'd like to do a couple of these lightning round questions. So these are informal, kind of
Sure.
icebreaker questions. If you could instantly acquire a new skill, what would it be?
Oh, wow.
Maybe something you've always wanted to be able to do.
Oh, wow. Let's see. What would it be? Probably to have instant recall.
Ooh, that's a good one. That's really good.
Yeah. To just be able to look at something or read something and immediately be able to retain it and recall it.
Interesting. How do you define a good day?
Oh, that's a good one. So a good day is certainly being able to accomplish my to-do list at work. Between all of the meetings that are oftentimes stacked on top of each other, and then the impromptu meetings and emergency needs that have to be addressed in the immediate. So that is certainly a part of my having a good day. But I'd have to say that the most important piece of my having a good day is being able to get home to my family, my husband, and my children, and to be present and available to them, and to be able to enjoy them and them being able to share with me what their day was like and participate in their world where I take the work hat off, and really engage in a active way and in an intentional way. I found that it is important to be able to have my children see that they can do things that are difficult, and that they can make an impact. And I hope that I'm modeling for them that they can go out in the world and dream big and do amazing things and, be a parent, be a spouse, and also navigate a wonderful job opportunity that may be presented to them, or build a business opportunity. Um, it's wonderful to be able to have the ability to have a family and raise children, and I have a wonderful supportive husband who helps me to juggle it all.
Good. Yeah, the way you talk about your mother, I'll bet you're succeeding.
Oh,
Because it
thank
sounds like you had a
you.
great model.
I
If you saw her
did.
work and
Oh,
yet
yeah.
you felt her love and her support.
Oh, yes.
Yeah.
I know I was blessed to have such an amazing mom
Mhm.
and an amazing village. My grandmother was, I would always say, the quintessential grandmother, the grandmother you'd see on TV. Summers were spent at her house. And we learned so much from how she cared and loved on us. And it is a blessing and a gift that I know I received.
The campus is 80 years old as we open the new healthcare facilities. So what does that mean to you, the 80th anniversary? How do you think we should celebrate it?
80 years is a tremendous milestone. This hospital is truly a diamond and a jewel in this community. And to be able to be a part of not just celebrating the 80 years, but to commemorate it in a way that will be life-changing for 80 years to come, and to have the new facilities that are state-of-the-art, and to really bring attention to the tremendous work that happens every day here at Harbor-UCLA, our providers, our nursing staff, the dedication that they bring to the work, and the significant progress that's been accomplished and made here at Harbor as it relates to medical care. One of my goals during my tenure here at Harbor is to really help people to understand who Harbor is, what Harbor has accomplished, what our goals are, and how we are really here to partner to help our communities thrive and to be all that they can be. It's really important for us to have even a proactive approach to medical care, where we help to educate and inform our communities about health and well-being. So there's so much that I see as on the horizon for us. I really see this 80-year point or milestone as a starting block for the next 80 years. And it's a way for us to really begin the work again, and to really pour into our community, our teams, our staff members, our patients certainly, and to help people to understand that Harbor-UCLA Medical Center is a resource, and it is something that will be a critical value for many, many years to come.
Just as sort of a closing question, you've just met somebody, they are a brand new employee. I don't know, maybe they work in the paint shop, maybe they work in the cafeteria or EVS or something, who knows? What's your advice to them? What do you tell them that they need to know about Harbor?
Every time we have our new employee orientation meetings, my goal is to help the new employees to understand that they have joined a powerful organization, and that they bring to Harbor-UCLA all of the skills and all of the training and all of the resources that they bring. And so I really want them to know that we're delighted to have them here. We're really counting on them to bring their expertise and their knowledge to the work, and that they have an opportunity to really grow here. That there's so many people that have been here for many, many years and have had various roles. And so there's growth opportunity. There's also an opportunity to consider how they will leave a legacy and what their legacy will be here. I understand that, people could go, especially in the healthcare space, and work anywhere. There's so many hospitals, so many medical centers. But when you choose to come to Harbor, for most, it is an intentional choice. And so I applaud them and thank them for joining this tremendous team, and that I really want them to know that they have the supportive leadership and that we want them to thrive here.
Terrific. Judith Millsap, thank you so much for your time. It was a real pleasure to talk to you and get to know you. Thanks for joining us. Visit the Harbor-UCLA Medical Center YouTube page or find us on Spotify to hear all of our podcast episodes and more.